Okay, that's the meeting recording, so I'll now continue to take the student. Councillor Kalikis?
Hi, I'm here.
You're here.
Sorry, can I just say I do need to leave the meeting at 3 because I'm double booked. I've got 2 meetings in, so I'll need to leave at 3 to join another meeting. Sorry.
Thank you, Councillor. Councillor Devlin, I can see that you're here. Councillor Donnelly, have you joined the meeting? You're here. Councillor Holford's here, as is Councillor LeBlanc. Councillor Lennon? Nope. Councillor Loudon? Yeah, I can see that. Yeah, I can see that Councillor Loudon's there. Councillor Lowe? Nope. I've just had a message from Councillor McGuigan to say that he will be joining the meeting a little bit late. Councillor Thompson is also here. I can see that we have Councillor Razak present as well. Are you observing the meeting, Councillor Razak, or are you substituting?
I'm just observing.
You're observing.
More substitute for Martin Lennon. Thanks.
Okay.
Okay, so you're going to act as a substitute. Thank you, Councillor. So we also have officers present: Alison Bell, Jill Batty, Kay McVeigh, Christine Calder, Sharon McGuigan, Bernie Perry. We also have Liam Purdy present, Head of Children and Justice Services and Chief Social Work Officer, as well as trade union representatives, and a member of the press has been invited. So I'll now pass you back to the Chair to commence today's business. Thank you, Chair.
Thanks very much, Elizabeth, and thanks for all your help there. We'll move straight on then to number 1, declaration of interest. No, that's great. Minutes of the previous meeting, could somebody move their correct minute there?
Proposed.
Okay, thank you. I'll second that there. Right, I think that's into our business then, item 3 in the papers, and it's Bernie Perry's got to give us this report here, mainstreaming equalities and diversity from social work resource. Go ahead, Bernie.
Thank you, Chair. Sorry, my connections were playing up on me there, so if you lose me, bear with me, I will come back in. Just to say, this is the Social Works Annual Report. We came last year, but it was the 18th of March, so you never got an equalities report from us, because we were just right in the middle of COVID. I had the report already, but that was the first meeting cancelled last year, I think. You have the report in front of yourselves, and maybe just kind of launch into the background in terms of social works, the raft of kind of legislation that we have, the backdrop of legislation that we have to work against. Any of the public services that we offer is kind of bedded down in all of the legislation. Now, the mainstay of that legislation practically aligns to the protected characteristic groups within the Equalities Act. So we target services towards child protection, children with additional support needs, looked after children, adult support and protection, mental health, alcohol and substance misuse, physical and learning disabilities, frail older people, people within the justice system, and also unpaid carers. And as I said, many of those kind of client groups align quite neatly to the protected characteristic groups of age, disability and gender. We, like other resources, kind of adhere to the principles of the Equality Act in terms of eliminating discrimination, advancing equal opportunity and fostering good relations throughout our work. We align our activities to the Council's mainstreaming equalities report, and that equalities report, there's a link in my report to the Council one, but its main outcomes, we're linking into 5 of those outcomes, and the appendix at the back of the report gives some of the examples of the work that social work kind of marry into those outcomes. We're not kind of giving you the full kind of thrust of all social work's activity here. It's just some samples of the activity that we have. And this report will be followed by a kind of more detailed presentation from Sharon around the work we're doing in See Here for those with a disability in terms of sensory impairment. This year as well is probably the last time we're going to report on these outcomes, the particular ones of improving service for older people, protecting vulnerable children, tackling disadvantage, encouraging participation and vision and strategic principles, because we're now moving into a new world going forward where there's a revised mainstream inequality for 21-25. So this will be the last year the report will be in this style of layout. I think it will change going forward because we've different outcomes to report on. Those outcomes are listed in the report. We'll be talking about and councillors, you'll be familiar with these areas of development and transformation because they've kind of been embedded in social work committee reporting on a regular basis. There's the care facilities, there's our day facilities for adults and older people, there's our home care services, there's the way we need to continue to support carers and how we protect all of our staff with the continuation of the PPP hub and all the associated work with that. And kind of finally, there's been a shift in some of the kind of hosted services from the North Partnership to the South. So we'll be kind of seeing the movement from some of the mental health services to South in this year. So we'll be reporting on that as one of our equality outcomes moving forward. We, like other groups as well, are part of the Mainstream and Equality group, the Council's corporate group, and meet on a regular basis with Allison and Gillian and our colleagues to make sure that we're kind of addressing equality issues across the Council. So people will know this year's been particularly challenging in terms of COVID and the way we've delivered services. And some of that, it won't be evident in the table at the back of the report, but when I looked at the one we drafted for last year, we'll see where services haven't been operating to the same level. So there's been kind of reductions in some areas, but then there's been increases in other areas. So we'll kind of talk through some of those examples, which are at the appendix at the back. So this year, a lot of our services had to have workarounds in terms of daycare. That kind of contact, we couldn't have people all in the building together. We're starting to kind of bring people back in now slowly, but social distancing, all of the kind of restrictions that we have, we need to kind of be careful how we bring those services back together again. There's been big changes in our kind of care facilities and in the residential sector. Care inspector and inspecting those services more closely now in health and safety in terms of COVID restrictions and kind of close testing and visiting and all sorts of different regimes in the care home world now than was ever there before. And again, a kind of emphasis on the PPP hub. It was never a service that we had in the council, but last year saw that kind of service coming in and the kind of whole stock control and the links in with procurement, the links in with the national kind of setup for making sure that we have that type of equipment at our disposal is very important kind of going forward, because we're not out of this yet. And as I say, at kind of 3.14 now, the restrictions might be easing and the vaccinations and the testings might be all happening, but we're kind of seeing that things aren't lifting up as quickly as folk anticipated. There's a variance about now that we still need to be very cautious about how we move forward with services. In terms of the number of equality impact assessments our resources undertaken, you'll see from the report as well, many of those were aligned to the kind of financial savings exercise. There was one service review, which is kind of daycare of older people's services, which also features in our kind of equality duties going forward, where we'll be kind of monitoring how we change and mould new services for daycare for older people and adults. Finally, I would maybe kind of bring you to the appendix at the back. I'm not going to go through each of those lines, but what we've tried to do is kind of give an example of the numbers of people that we have supported and maybe the difference that this has made, and aligning each of those to those kind of mainstream and equality duties of improving services for older people, vulnerable children, etc., etc. And as I say, I don't think it's necessary for me to go into the detail. You may have questions that you want to pose on some of those areas. So, Chair, I would pass it back to you, that I would like you to note the content of the report and offer it open for any questions from any members on the table.
Right, thanks very much, Bernie, for that comprehensive report. I'll open up in 2 seconds, just a couple for myself. One about it's a continuous one about the age population. We've got people working in social work, especially in care homes. See, it still seems to be women, and obviously a lot of the women coming to maybe the retirement years. Are we doing what we're doing actively to maybe encourage men or younger people into social work? Another one was see the direct payments. Have we any problems at all with that, or have we found cases of people like relatives not trying to claim this money and that, or disputes within family? Because I heard there a couple of cases. Is that just now and again, or is it rife? Thanks, Bernie.
But Councillor, in terms of encouraging men, I'd maybe kind of ask Kay to kind of chip in about that, because I think there is always a drive to kind of get a gender balance in the kind of working population of the council. And being one of those kind of flexible retiree people myself, you know, we can stay on working for longer and longer as long as we're still fit. So maybe Kay, you would kind of add some commentary to the gender-based employment.
Yeah, I can certainly start off with that bit. So we keep a close eye on the makeup of our workforce, and we do that fairly regularly as part of our workforce planning process. We do have Delivering a Fairer Future, which is trying to bring men into predominantly female areas and vice versa. So we continue to look at our advertising and see whether we can be encouraging more applicants from the opposite gender of whatever happens to be the predominant sex in a given area. We've also got our modern apprenticeship route through into social care, which again we're trying to bring more young people in. I would say the average age in the council generally has come down very, very slightly across the years, and I say that because at one point I was tracking the average age, and now I'm not. So that's why I happen to remember some of that. But as Bernie has said there, we've also got a growing number of employees who choose to flexibly retire rather than fully retire, and we encourage that too. So we've got a fair mix there. Thanks, Chair.
Thank you.
And Councillor, back to your direct payments question. I think some of that is a bit of hearsay, you know, in terms of family members and abuse. I'd go back maybe 10 years when there was more of that evident. We've kind of quite closer controls on things now. And yes, family members can take direct payments, but it's kind of closely monitored. We also had arrangements in place recently where we did a big kind of review of direct payments, and a lot of money was clawed back into the council for that.
Yeah. Okay, right. Thanks very
not
much.
Been spent for, so there has been a drive to kind of improve that and make sure that the public pound's spent properly.
I appreciate that. Thank you. I'll open up now the committee, the forum, and just if Elizabeth Ann, if you could guide me, if you could see the hands and make sure I don't miss any. So, any of the forum like to ask anything?
I see no hands, Chair.
Might all get away at 3 o'clock then. That's good. Well, if everybody's happy, then I just like to. We'll note that, Bernie, and thanks very much for your presentation. Thank you.
Thanks, Councillor.
Okay, we'll move on then to item 4, See Here framework. And I think it's a presentation by Sharon McGuigan. Sharon, if you want to go ahead there with your presentation, please.
Thank you, Chair. I will try and attempt to share this. Hopefully it'll work. Just let me know if you guys can see that.
That's fine, Sharon.
Okay. Right, my name's Sharon McGuigan and I'm currently a Planning and Development Officer within Social Work, responsible for supporting and taking forward the See Here agenda on behalf of South Lanarkshire Council, the Health and Social Care Partnership and the Third Sector. The presentation today is one that I have been delivering to health and social care staff to raise awareness of sensory impairment and how we can help ensure fair and equitable access to services. But I also want to talk briefly about how we have tried to continue this during the COVID pandemic. Let's see if I can move this on. Okay. The See Here is a national strategic framework for sensory impairment in Scotland, whose objective is to promote and protect everyone's right to equality of access to public services with a seamless multi-agency provision of assessment, care and support to children and adults experiencing sensory loss or impairment, to ensure ease of access to services by identifying and removing barriers to healthcare, education, rehabilitation, employment and support services, and driven by the partnership, undertake work to identify local priorities and develop work streams, timescales and implementation plans for the See Here recommendations and areas for action. In 2014, the Scottish Government worked with representatives from local government, health boards and third sector and published the See Here strategic framework. Then in 2016, research was commissioned by North Lancashire Council, South Lanarkshire Council, which captured the lived experience of people with sensory impairment and informed the development of our own See Here strategic working group and development of our action plan. Our partnership See Here plan takes a practical approach to ensure that following diagnosis of sensory loss, patients, service users and providers have a clear understanding and expectation of what supports and services that are available and how they should be delivered. The strategic framework applies to children and adults living with sensory impairment, which includes varying degrees of hearing loss, sight loss, and loss of both of these senses, and can be a recognised sensory impairment, a risk of sensory loss, or hidden and untreated sensory loss. I think I'm way ahead of myself there. The greatest problems experienced by sensory impaired people are communication and or accessing information. For example, those experiencing some level of sight loss face the inability to access printed material. There might not be large print or braille versions available. Difficulty getting to destinations, so moving around the built environment, accessing unfamiliar buildings. They're unable to read signage. And this is exacerbated just now because of the amount of outside hospitality due to COVID. Difficulty in accessing information online via the internet and using electronic devices often requires specific software. For those with hearing loss, difficulty using auditory communication, for example, they're unable to hear voicemail messages, online auditory messages with no captioning, videos or oral communication without accompanying manual service such as British Sign Language, and face coverings during COVID have prevented their ability to lip read. There's also a lack of awareness from others as to how to help. And correspondence can be seen as complicated because of the wording of the letter, which often asks for a telephone response. A recent consultation of people with a sensory impairment carried out by BID Services, which is a charity supporting those affected and their families, wanted to establish the level of social inequality and disability discrimination people with sight and hearing loss face in relation to dealing with health and social care services. They found that basic transactions like making a routine appointment proved difficult unless the person physically visited the the office or the GP's surgery. Even more concerning was their inability to book an emergency appointment, as they often didn't know how to do this. Furthermore, deaf people said that they could only understand some of the information communicated to them, resulting in a limited understanding of their medical condition. The study found that healthcare professionals didn't automatically offer the opportunity to have an interpreter in attendance. So when deaf people appeared for appointments, a British Sign Language interpreter was often not present. The study found that healthcare professionals preferred to use notes or family members or friends to sign for the person. But however, this is not a really suitable approach. Friends and family members have personal and emotional attachments. They usually don't want to confuse or upset their loved one or be the bearers of bad news, and can end up adding their own opinions or withholding crucial parts of the message being conveyed. There is a good chance that they're not fluent in all of the medical or technical terminology that they may need to interpret. And they may also not be aware of the professional and ethical responsibilities of trained interpreters. So this means that they may omit keywords or summarise the message, which results in an inaccurate interpretation. So in order to improve inequality and accessibility for people, we need to ask how they would like to communicate and offer appointments in a format that supports this. We should be looking for longer appointments, never expecting family members to interpret, and making hearing and sight loss awareness training mandatory for all frontline staff. With increasing longevity among populations, age-related vision and hearing impairments are becoming prevalent conditions in older adult populations, and this can have serious effect on a person's communication, confidence and independence. Studies have found that depression among people aged 65 and older is a major problem, as they experience difficulty adjusting to their sensory loss and exacerbating feelings of isolation. Many people with dementia will also have some form of sensory impairment. The Alzheimer's Society produced a booklet called This Is Me as a communication tool, which has been endorsed by the Royal College of Nursing since 2010. This is for anyone receiving professional care who is living with dementia or experiencing delirium or other communication difficulties. There is a specific section within this leaflet entitled My Communication and Mobility, which captures information about hearing, eyesight and preferred methods of communication. For us within social work, the Swiss Plus communication section in the personal details tab now captures the service user's preferred method of communication and any impairment details. And a reminder notification has been added as a prompt for users to ensure that this is completed. The support aims of the framework, the partnership have developed a See Here strategic action plan. And the plan aims to ensure that all employees consider sensory impairment at all points of interaction with patients, service users and carers, which align to the following actions. So ensure that the needs of sensory impaired people are considered within assessments, understand the housing needs of sensory impaired people, improve the health and well-being of people and carers who have a sensory impairment, introduce screening for sensory impairment at significant points, for example, admission to care or hospital, identify the needs of the wider South Lancashire Partnership, the training needs, of the wider South Lancashire Partnership, address the mental health needs of people with a sensory impairment, ensure consistency and quality of recording data on the needs of sensory impaired people to allow effective local planning of services, and consider the needs of children and young people who have a sensory impairment. So what progress have we made? We have remodelled the See Here webpage with numerous links added to help inform and signpost people and their family and carers to what supports are available. A core brief to raise awareness and inform care planning has been drafted and submitted for approval for distribution to all employees. The Contact Scotland BSL link has been added to all South Lanarkshire employees' email signatures. We have updated the co-produced assessment to make the secondary conditions pick list a multiple choice option within Swiss Plus. Basic sensory checks guidance has been issued to locality managers, the community living manager and the wider locality to introduce the same within local care planning, community facilities and residential units. The Director of Allied Healthcare Professionals has been identified as the link for sensory impairment screening at hospital admissions and is taking this forward. And the new carers service specification includes the relevant See Here carers measures. The preparation of in-house deaf culture awareness Learn Online training is currently underway, and the Scottish Government's deaf awareness and sight loss awareness training modules have now been made available on South Lancashire's Learn Online Brightwave platform, as well as the NHS tourist system. Audiology awareness and hearing aid care and maintenance training has been developed and has now been rolled out to over 3,000 staff in South Lancashire care homes and acute hospital wards. And there are now a number of trained staff on every ward, and this will continue to be a rolling programme. Prior to lockdown, the hearing aids battery replacement programme was put in place within all libraries to make it more accessible throughout South Lanarkshire, including the mobile library for people who are housebound. But we still have a lot to do. Throughout the pandemic, we have worked with partner agencies and the third sector to provide information and guidance for people within our communities living with sensory loss. For example, following the first lockdown, we issued guidance from the Blind Veterans Organisation on what people could do to assist someone who is blind or partially sighted with shopping during the COVID-19 lockdown or if self-isolating. In April 2020, we issued a document to help staff identify the most important things they needed to do to communicate effectively with their sensory impaired service users and patients to support their health needs. We also included links to a wide range of third sector groups who could also offer support. In summer 2020, an email containing a link to the BSL video introducing the Protect Scotland app, alerting you if you've been close to someone, another app user who has tested positive for coronavirus, was sent out to all health and social care employees for information and to share with service users and patients who use BSL. And we also issued a link and information regarding the hashtag Be There campaign to all health and social care staff to share and encourage members of the public to offer assistance and support to people with sight loss while they tried to maintain a 2-metre distance. We circulated the new podcast series, Chats About Apps, which is available on the RNIB Older People podcast series page. The series is a series of 6 podcasts produced by RNIB's Older People and Complex Need team and the RNIB Technology for Life team, which explored the range of simple apps which can be used in everyday life to support people with sight loss. We also shared a lot of this and other information on our website and via our social media pages or platforms. So we have a duty to provide services to everyone who needs them and can be found in contravention of the Equalities Act or Disabilities Act if we fail to do so. The Equalities Act states that public authorities need to remove or reduce disadvantages suffered by people because of protected characteristic, meet the needs of people with protected characteristics, and encourage people with protected characteristics to participate in public life and other activities. So to help ensure the needs of people with a sensory impairment are being met, this is a quick session that is being provided to frontline staff to make them aware of the See Here strategy and what we aim to achieve. At these briefings, I urge everyone to take some time to read over the framework, consider how to best support the objectives and disseminate this information to operational colleagues throughout their locality. Frontline staff are also made aware of the See Here page on the Council website so that they can signpost service users and their family and support networks to the information links contained within it. I encourage anyone who is aware of areas of good practice that link to See Here to share this information with me, and I then take that back to the See Here Strategic Working Group for distribution throughout the partnership. Thank you for listening so patiently, and does anyone have any questions?
Thanks very much there, Sharon, for that report. Not so much a question, but a quick observation. And about a few meetings there, people might have heard me saying this. My son broke his 2 shoulders and he's deaf. He was in hospital. And his partner was there and she was asked to leave. And she goes, well, you got to get an assigner then? He goes, it'll take maybe a day or 2 to arrange it. So for a day or 2, he was in hospital with no communication, really. And also the hospital staff, of course, have to wear masks. So he couldn't lip read and he couldn't sign. So he was in a terrible situation. So situations can come up and it really does put people with a disability like this a very bad stage where they feel lost, they feel out of it, they feel nobody cares. They get actually depressed and signed themselves out of hospital. But it was just a bad luck story. It just happened. It was a time of people to wear masks and we couldn't help it. But things are bad and people can be put in very bad situations. Anyway, he's over it now. So enough of me. Any of the forum like to ask anything?
Councillor Holford has his hand raised, Chair.
Thanks, sir. Go ahead there, Eric.
Hi, thank you for that. It was good. I enjoyed that. Actually, that's really what Bert just said there was interesting, because part of one of the things that you said during the presentation was to get away from the idea that friends or relatives should ever have to translate in medical situations. I suspect that's always going to be the case because there just aren't enough BSL translators. I mean, it's lovely to think of a perfect world where you can get a BSL translator at the drop of a hat, but as we already know from some of the things that have happened in the council since we have had a BSL user as a councillor, that's not always possible. But the question I wanted to ask you about was housing. Actually, you mentioned in there about suitable housing, and it's always struck me as a bit of an issue that the definition of accessible housing is all based upon a 6 foot male wheelchair user with good upper body strength, which doesn't even define me as a wheelchair user, let alone does it define people who have hearing or sight difficulties. So I'm just wondering, if we were to look at the question of suitable housing for people with sensory issues, what sort of things would one add to a house to make it more suitable?
I'm not the representative from housing, but I know that we've discussed things like what we have in the offices, even where you have lights that will flash if an alarm, you know what I mean, is going off, a fire alarm, the kind of health and safety stuff that you would need in place. But we're at the kind of beginning of those discussions with housing, but I can certainly go back to my colleagues who sit on the panel on the forum from housing and get you more information, Councillor Halford.
That would be good. I'm interested particularly in what needs to be built into houses as opposed to what can be added easily, retrofitted to houses. And for example, in order to make a house wheelchair accessible, they make sure that there are no steps to get into the front door and there's a nice, easy entrance. I'm interested to know what the equivalents are for people with sensory issues. Thank you. So yes, I'd be grateful to hear back.
I will get that information back to you.
Lovely.
Thanks very much, Eric. Is it Mary? I see Mary up with her hand up. Go ahead
Yes,
there.
Chair.
Thanks. So go ahead, Mary.
That's me. Yeah, that was actually a very, very good presentation that you did there. It was really informative. But one of the things that crossed my mind was, now that we're going into YouTube, with all the departments, you know, and committees, like even today, this meeting, I know that we've not got a sign language person here following this committee, but when it goes on YouTube, is there somebody doing the sign language from BSL going forward? Just that thought I had.
Yeah, I'll maybe defer to Alison Bell, my colleague Alison Bell, with that, because I know we've had multiple discussions about the various things that we put out publicly from the organisation being available in these different formats. It actually does present difficulty for anything historically. It may be something we're able to do going forward, but Alison might have more information on that. Councillor Donnelly.
Okay, thanks, Sharon. Just to let you know, this is something that we're looking at the minute. We are exploring the various options that are there, including signers at meetings, or I should call them sign language professionals. At meetings. Yes, they are professionals. And also looking to put captions onto meetings as well. So it's something that we're at the early stages, but we're definitely looking at this.
Are you okay, Mary, with that one, that answer there?
No,
Chair, I think Jill would like to come in as well. I don't know if it was on that point.
Okay, Jill.
Thanks very much. It is just on that point about the sign language professionals. So you have the issue about there being a delay while the captions are being done. So what we're looking at is whether there is capacity to have live signing at committee meetings, which would give access at the same time for hearing and non-hearing people. I think the issue is about capacity. Yeah. Because there are very few appropriately qualified sign language professionals in Scotland, more in the wider UK, but they're very much in demand. And if they are being used for this sort of thing, then that makes them not available for the more emergency type situations, like Councillor Thompson mentioned, you know, people in hospital, which cannot be planned and predicted. So I think there is a longer term consideration that we have to give to how to create greater capacity around about sign language professionals to support committee work, but you know, the wider work of the council as well. So we are giving that quite a lot of thought at the moment.
Just to come back there.
On you go, Mary.
It's about this inclusive world that we are trying to create. And I've been watching things on the TV where there was a young mum who was deaf, and it was down south, not up here, because we do have the COVID talk, you know, the COVID programme it has got a BSL interpreter every day or when it's on, but down south they didn't. And it was just, that woman was expressing just how much she was alienated, and very much like your son, Bert, but alienated and what was changing within the world, and to keep them abreast. So although I accept the fact that there's a delay and we're working on it, I think time is of the essence also for people to be informed about, you know, what's happening at committee level. If it's going on YouTube and people can access it, that is obviously everybody should be able to access that and should know what is going on in the council. I think that's vital.
I agree, Mary. So it should all be about inclusion. Inclusion's the word there. I see, Eric, is that a new hand up there or a legacy hand? I think it is.
Chair, I don't know if Kay wanted
Sorry,
to come
it
in
was
on
a new
that
hand, but
one.
Katie was first.
All right, on you go. Right, who's the line of order then, please?
Sorry, I think Kay perhaps wanted to come in on that
Kay.
point, and then we have Councillor Loudon, followed by Councillor Holford and Councillor Razak.
Okay, thank you then. Right,
Thank you, Chair.
Go ahead there.
So
right,
obviously
thank you.
a lot of interest, which is always
Yes,
good.
it's always
I think
encouraging.
I think we'd all say we'd love to be as inclusive as we possibly can be and make that easy for people. I think the only other thing that I would add to what Jill's already said is there are also subtitles available on YouTube, just as a matter of course. They're not always, I know this because I use that myself for other things, but they're not always desperately 100% accurate, but at least it'll give a flavour of what's been going on along with the minute in the meantime, as well as we try and source a longer term solution.
Yeah.
Thanks, Chair.
Right, thank you. Thanks for that. I think it was Katie next. Yes. On you go, Katie.
Thanks, Chair. Hi. Just to change the subject slightly, I saw the presentation as well. We had the part about working with the library service for providing hearing aid batteries and so on. I think it's maybe something for the forum at another time, but I think it would be good to have an input from SLLC about library services in particular. I'm not declaring an interest, this is a previous interest of mine. I have done some work in this area. I was looking at library services in Glasgow in the past, and I know that we're very good in terms of the digital catalogue which we've got and so on. But I think it would be good to get some more information and maybe explore some other avenues for the way that services can be put together and how things could happen under the same roof and people could be signposted to them, the batteries being a perfect example. But I was just thinking, so this, we're talking several years ago now, but I'd visited the RNIB Centre in Partick, for example, which has got a great IT suite, a lot of specialist equipment, a lot of things that are very expensive to buy, like screen readers and different keyboards and all of these kind of things, which are great for people with visual impairments. And then that's linked in with employability work and so on. Very difficult to have that level of service across a whole library service, just because the equipment could be sitting gathering dust, might not be used very often, and so on. And until COVID times, well, especially if you live down this end of our local authority, it's relatively easy to hop on a train to Partick and be right there and make use of those services. But since people haven't been able to travel into Glasgow and so on, it's maybe been more difficult. And I'd wondered about, I know Macmillan have done a lot of great work coming into libraries, so rather than us trying to reinvent the wheel, it's someone who can provide a specialist service coming in on a rota basis and working with libraries within a particular local authority as a sort of outreach and to find out what's needed. So I just wondered if that was something we could explore. And also, I said that, any other groups to link in with. I know that Visibility have done a lot of good work with our local authority before, as well as have RNIB. But I'd wanted to give a particular shout out to the Haggai group within the RNIB, which is specifically for young people as well. I do appreciate, and in terms of sight loss, then obviously the demographic can tend to focus on older adults just now because that's the sort of growth area, if you see what I mean. But Haggai, so it's like Haggis, HA-double-G and then I, as in your eye. They do a lot of work in terms of advocating for young people with sight loss as well, talking about policies, talking about working with the Scottish Youth Parliament to identify barriers to their everyday life and so on. So I think that would be a good service to link in with at some point, and potentially invite some young people along to the forum to have a chat with us as well.
Yeah, thanks very much for that, Katie. That's something we could certainly look at for the future there. Take that on board. Thank you. Is it back to, I think Eric was next. Do you want to come back in, Eric?
Yeah, just about something different. You were talking there about sign language professionals, and I think obviously there's a huge shortage of them. But what about sign language amateurs? It seems to me that when I was at school, some people went off and studied French at a degree level, and a large number did French at A level, and a large number did French at O level, and a larger number, like me, did it for just 2 years. As a result, I have a very basic grounding in French. But my chances of meeting a deaf person in Scotland are much higher than of meeting a French person. I also studied Latin, and my chance of reaching speaking to a Roman are nil. So, but I still had to do 2 years of Latin. I just think it might be a great idea to try and encourage schools to take on the teaching of basic sign language, because though you wouldn't expect everybody who learns a bit of sign language to become an expert in it any more than I learned how to order a coffee and a croissant in French. But it would be great to have a pool of people from whom you could then hopefully coax out the professionals of the future.
Eric, thanks very much for that. I'm embarrassed to say that I'm not a great signer, and yet my son's deaf. But what I can tell you is that the basics, I call it the basics, like colours, numbers, things to say like names, where are you going, how's that, would you like a drink, the basics, and even with that, having some sort of conversation or understanding is a benefit. And when I get into company with deaf people there, they really, really appreciate that. Just it's like being abroad. People appreciate you making an effort to meet them halfway with their language or their communication skills. So it is worth thinking about that, Eric, and it's something that people might be interested in doing. And even, like say, a couple of online 10, 15-minute tutorials. And it's amazing how much you pick up and how good it makes you feel being able to do that. Thanks, Eric. I think it's Councillor Isaac. Go ahead there, Mo.
Thank you, Chair. I was going to ask that if someone's contacting the council helpline, would there be some sort of a form of video conferencing be made available to that which they can sign, or they can send an email asking for that? And the second part was that one of the complaints I know is partly to do with hearing impairment is that with the shutdown with COVID and everything else, they're finding it very difficult to source batteries, get hold of the batteries for the hearing aids, which I don't know if any other council have had that issue with constituents complaining about it.
MD could answer that there or put a comment on it there. No,
I'll take that back to the group, Councillor Razak, to see if there's something else we can do about getting the batteries made more available.
Thanks, Sir Sharon. That would be most welcome. Maybe keep moving the group, the forum in the loop there, how you get on with that, please. Because it is quite interesting. Just you don't realise the things that can come up. Just if I go back for 2 seconds before the final item, Councillor Holford there. You learn something every day. I know it's an old saying, but it's true. I had a brother-in-law there just that get his leg amputated, and they were going to put a stair lift in his house, and but everything was fixed, and they were all happy about that and getting the help. And then in hospital, it developed to get the second limb removed, and I didn't know that with 2 limbs removed, health and reasons, safety reasons, you can't get a stair lift. So the house they thought they were getting is now they can't get it. So it's back to square one. So you never know the barriers that will come in front of you. And I thought that would maybe add to their argument for this house, but apparently both limbs go off, health and safety, you can't get stair lift, you can't get the house. So no complaints about them, there's just one of these things that's health and safety, you've got to live with it. Anyway, sorry for the wee rant there. The final item today is...
Sorry to interrupt, Chair. Sorry, I think Jill and Kay might have wanted to come in to one of the previous points, and we also have a hand from Councillor Loudon as well.
Right, we'll get back to Councillor Loudon in 2 minutes. Who was first there to come in?
I think Jill's hand was up first,
Jill.
Chair.
Okay, so I'm just going to jump in. It was about the point about training sign language interpreters for the future. So one of the things that we had started, it must be maybe 2.5 years ago or so now, was making it part of induction for all of our modern apprentices. So when they start, as part of their equalities induction, they do some sessions on basic British Sign Language for precisely that reason, to try and identify people who have the skill, the interest and the capacity to build on it, so that we might be able to develop signers for the future. It's one thing to be able to do those kind of meet and greet things, but it's quite a skill to be able to do more complex interpreting, and it is a skill that you need to keep up to date, so you need to have that kind of commitment to it. Just as we've been talking today, I've been trying to think about how else we might tackle that issue of capacity, given the fact that there's going to be a high level of unemployment and we might have people looking to change direction in terms of their career. That might be something that we can look at for the future, but there's certainly been food for thought today round about that particular issue, so thank you.
Thanks very much, Jill. I think we'll move on to, I think it's Kay and then Katie. On you go, Kay.
Thank you, Chair. I was just going to come in on the hearing aid batteries, because I do recall under the wellbeing line, we were actually delivering a fair number out on the basis that people couldn't access them in the way that they normally would. If it'd be helpful, I'll ask about how many, how much support was provided through Rhonda's team in that area. Thank you.
Thank you. Just so you message here, is that right? Audiology will in fact post them out to you if you have difficulty, getting to the place. That's quite encouraging to know, and information you could certainly pass on. Sorry for keeping me there. I believe it's Katie. Come in there, Katie, please.
Yeah, I don't know if anyone can hear me or see me, or they're probably getting an echo. My laptop has frozen, but I'm on my phone. But I'm on in two places. Just to quickly say, a couple of years ago now, I think maybe about 3 years ago now, as counsellors, we were offered a taster session with Deaf Services Lancashire, which, sorry, I can hear my own voice, I'm sure you can as well, which was like a one-day taster session. It was absolutely fantastic. It was just jump right in and give it a shot. It was deaf, what's the word I'm looking for? Instructors who were leading it. It was really, really good, and I would welcome the opportunity to do anything like that again if the opportunity arose for counsellors, whether it's for all counsellors or whether it's for this group, just to encourage other people to take it up if it comes back along.
Yep, that sounds quite encouraging.
Fix my problem, sorry.
Okay, thanks, Katie. I'm sure people would take that up there. I'm sure they would. Right, if there any other hands, is that?
No more hands, Chair.
Okay, thanks, yeah. I think we'll move on to number 5 then, seniors together, and it's Christine Calder's got to present this paper. Go ahead, Christine.
That's me. Thanks very much, Chair, and thanks for giving me the opportunity to update the forum on the Seniors Together Use It or Lose It project. And the recommendations are that the forum note the content of the report. So the background to developing the project involved research and information about the ageing population and the related increase in chronic diseases and the impact on healthcare systems in most of the Western countries, and how these could be prevented, for example, through physical activity and diet. We discovered that monitoring physical activity in older people is a valuable parameter to define if they're performing enough physical activity in order to prevent chronic diseases, or if they're manifesting early symptoms. I've been having problems early with my sound, so bear with me if it's coming and going. The onslaught of the global pandemic has created issues for older people in South Lanarkshire who have been working really hard to self-manage their own health and to maintain their independence by being locked down. So at 3.2 there, members of Seniors Together who have regularly attended active day fitness classes at South Lanarkshire and Leisure and Culture began reporting to us how they were struggling with their loss of mobility and loss of confidence as the lockdown has continued. So at the Seniors Together project, we started to think about how we could engage with members because we've been locked down. So we've got a member of staff who was responsible for the mobile men's shed, but because it was off the road, we started to think about how we could fill in his time. So we used his time to upskill all our members and made them proficient on Microsoft Teams. So he stood in gardens, I'm sure I've told you before. He spoke to people on phones. He shouted through the window, see that wee button up at the top of the screen? And slowly but surely, we got a significant amount of our members online talking to each other like this. And through those conversations, they said to us, we are losing, some people were saying, we are losing the ability to put one foot in front of the other. That's when the conversation came round to, we need to use it or lose it. So it was the members of Seniors Together themselves that came up with this idea. And so the project was born. So at number 4, we thought about seeking funding for a falls prevention project, but then we come up with we thought, let's start small, in-house, small partnership between Seniors Together and South Lancashire Leisure and Culture, where we would seek a small group from our membership and from Active Health, where we would select participants and give them a Fitbit, a wearable device, and we would need people who would have a smartphone. And if they didn't have a smartphone, we'd provide them with a tablet. And participants would then be asked, they would be given a daily number of steps that they would have to complete. We would also prompt participants when they would have been sitting too long. And this would then help them then to encourage them to move, to build up strength and balance. But not only that, during this period of lockdown, we've developed quite a significant number of people following our Facebook page, and South Lancashire Leisure and Culture have very kindly developed a move about break that our members are now following on a daily basis. So the people in our Use It or Lose It project would be encouraged to join the move about break daily. So once we've got our members moving about doing their step count, joining their move about break, we would then develop our online resource pack so that they would be guided to other leisure and culture classes that are available online. So at 4.2 there, you see that people would be given a fuller resource pack of information to guided exercise, so each participant would be supported by our men's shed stroke fitness guru at Seniors Together. But not only that, as we start to unlock, and we're getting there now, that most of our members now would have their second vaccine, people will be supported to join our South Lancashire Leisure and Culture outdoor classes. So we have that building up of confidence that people have from the guided and support of their Fitbit project indoors to then moving to outdoors. Because we've been very successful in engaging people in their chats and conversations through Seniors Together, with our general members, everyone that takes part in this project will be encouraged to meet each other online for a weekly social so that they get to know each other here, so that when they start to move towards outside and going for walks and meeting classes outside, then they've already got that support network there with their fellow Fitbit chums. So just moving over the page to number 5, with all things small like this, there's always the evaluation Because obviously we're hoping that we can start something like this on a very small basis, but we're hoping that our colleagues in health and social care and health improvement would look at the data from this and say, well, maybe it has got an applicability when it comes to rehabilitation and people who are living with long COVID. So we're looking for our partners at South Lancashire Leisure and Culture to work with us when it comes to the evaluation. There is a health and wellbeing scale called the Warwick Edinburgh Health and Wellbeing Scale, which is well known. Fortunately, there's a reduced scale which has been signed off, and we would use that, collect some base information at the beginning before we embark on the project, and then at the end just check in with people then with the same set of questions and see how people are feeling at the end. Research tells us that you know, people have tried this before, using wearable devices for older people, and research tells us it's never really been that successful in the past. But because of the coronavirus, we're living in a different time, and in Seniors Together here, we know that the timing for this is a good time because we've been so successful in encouraging and getting older people onto teams, people who have always been reluctant in the past, but because of those feelings of loneliness and isolation, and because people have been keen to stay engaged, then those who have been reluctant have overcome those feelings of fear and reluctance. And I think because we are a trusted source, that all of those elements together have brought people online. They've taken away those barriers that were there. And so in terms of coming forward and taking part in something like this, gives us the confidence to know that people will be willing to step forward. So at number 6 there, the impact then that we would be looking to see are the older residents in South Lanarkshire who have experienced poor mobility due to the impact of COVID-19 will have improved strength and balance. They will reduce the risk of falls by taking part. Older people will have increased confidence by using the technology. Older people will have engaged in guided online exercise programmes. Participants will feel more confident about re-engaging with centre-based activity programmes when they become available again. And currently, South Lanarkshire Leisure and Culture this week have, tomorrow will reintroduce their first active day, and that's out of 12 active days for people age 60 plus before coronavirus. So it's still very, very small steps. So we're glad to be at this stage introducing this. Older people will feel more confident about re-engaging in their community. And that's a huge thing because it's not just active days that older people contribute to. And older people will feel confident about managing their own long-term health condition. And that's the bit from the beginning about the research that we looked at before we even thought about the Fitbit project. And I think that's the thing that my colleagues here from Health and Social Care will be looking to in the future, because that's the thing that I think we're all interested in. It's about prevention. I don't think any of us here want anyone to look after us. We all want to look after ourselves. We all want to maintain our own independence. And I think the more the members of Seniors Together trial this kind of thing out, I think all of us here are the ones that are going to benefit. Thank you very much for listening.
Okay, thanks very much. They're interesting things there, and some of the words you were using there, like identify, prevention, elderly population, one of them. So I know how important it is and how important it is to keep fit. Prevention is better than cure, and being fit is should help there. I see some colleagues making comments as well there. Right, enough of me. Any comments or any observations? Anybody like to say anything?
Chair, we have councillors Devlin, followed by McGuigan and Halford.
Okay, go ahead, Maureen, please.
Bert, thanks, Chair. Christine, I think this is a brilliant report. I think we're missing a trick. You should have the senior park run, because the park runs are done all the time in the wee local. I'm not saying it should be the 5K. You already have a whole load of information with all the seniors that have got the active membership through the through our leisure and culture. And I definitely think you should work on that, because if you go to the park run and you are that bit older and you're not that fit, it kind of puts you off if you walk around it. But I think it's a great thing that the time you at the start of it and the time and where your times and everything are. I definitely think it should be developed from there on, even if it's just round your wee local park. If you could get somebody to lead it, it doesn't need to be a 5K, it can be half a K, you know what I mean? But just the other aspect to that is the socialising that means to say they're in contact with others. And it really is good. But no, I think it's a brilliant thing. I definitely do. Thanks for that.
Thank you.
Thanks very much, Chair Maureen. Thank you. I think it was Councillor McGuigan. Go ahead there, Jim.
Okay, thanks, Bert. And I mean, really, what Maureen's saying there is yet another way in which we can actually develop this. And once we get this out into the public domain, there is so much input that can be made by people who want to get involved and take it in different directions as well. I mean, that having worked closely with the seniors together, I think that the work that they've been doing is fantastic. I think like any other groups, etc., they're in a situation where they're having to think out the box, and all the taboos that were there previously have been essentially eradicated. And I think that if we get to that situation where we're able to think out of the box, put new things into place, new ideas, really just scrap the rule book and start again, I think this is fantastic. And I think that the fact that we have such a large mailing list and contact list within Seniors Together helps us considerably, because I work in the basis that for every contact you make, that person will make another half dozen contacts. So you can imagine the contact and the spread that's there for us to be able to make, and it really just is. I commend this report and obviously look to the recommendations and concur with them completely. Thank you.
Thank you.
Thanks very much, here, Jim, for those comments. I think it's yourself next. It's Eric. Go ahead, Eric, please.
Hi. Yeah, I thought it was great. I realise exactly what's going on here, because over the period of the lockdown, I spent months without even going out the front door. Literally didn't leave my house, and so as a result, I spent a lot more time sitting down, a lot more time not moving about. Just the exercise of getting in and out of a car and getting my chair out the back of the car and setting it up and so forth. It's probably the biggest part of exercise in my life. And coming to the council, when we actually came to the council, was probably the most exercise I got. So yes, I think the idea of encouraging people to exercise together apart was really good. So I was pleased to hear that. And by the way, yes, I would like to be looked after too. I want a valet. I've always wanted a valet or a Batman, but I've never had one, and sadly, I don't think I ever will. But there we are. Thank you.
Thanks. Thanks very much, Eric. We'll work on that for you, maybe for Christmas.
Sure, I think Kay wanted to come in, followed by
Yes.
Councillor Loudon.
Okay, go ahead there, Kay.
Thanks, Chair. I think Chrissy's making a cracking point in terms of it as an idea. It's an idea whose time has come. It's let's grab the positives out of the kind of experience that we've all had through the pandemic, and certainly I know from Councillor Thompson, you were talking about your own family earlier on. I'm just back from a visit up to Aberdeen to see my folks, and my dad's got his first computer that is connected to the internet. I did have to fix my mum's laptop because she'd lost the internet, but all that aside, they have managed to capture the new technologies that are out there so that they can keep in touch. They're kind of both fairly isolated. So, as Christine said, kind of the circumstances are a bit different. It's an idea that we maybe tried and not necessarily had 100% success with in the past, but I think people are now ready for this idea in the future. And as folk who know me well, I'm not a big exercise fan, but I think even I could manage the walking around with a Fitbit. Thank you, Chair.
Thanks very much, Kay. And I think, Katie, you want to come in there?
Thanks, Bert. Just a quick idea for the future. Obviously, at the moment, we're limited in terms of being able to invite anyone else into or even outside in playgrounds or schools and nurseries at the moment, but it might be good fun to link up with education at some point. We've had projects at other times where we've had nurseries linking in with older adults as well, to the benefit of both the kids and the adults themselves. And a lot of some of the background here about obesity levels and improving fitness and increasing activity levels and so on. There's been a real focus on that with some of our youngest residents as well. And the idea of being able to link something like this in with the Daily Mile programme, for example, where your Daily Mile could be you walk around and you've got somebody to talk to, and that wee bit of social contact as well, might be something quite nice to look at in the future.
Yep, thanks very much for that, Katie. Took that on board there. Is there anybody else with a hand up?
No more hands, Chair.
Okay, well, I'd like to thank you. Just before I go, just a quick mention that I'm meeting with heads of services soon. We're trying to arrange a meeting. Elizabeth Ann's doing that for me to discuss wheelchair and people with any sort of disability there entering the building, the county buildings, but not just that, but for the wider council area, all the council buildings, just to get feedback on how up to date we are and how much more work needs to be done possibly. And we'll report back to that, obviously. Another one was we're hoping to get somebody for the women's group to speak to us, I think, maybe in September, about their particular issues, which should be very interesting, informative, and very current. So look forward to that, maybe next September meeting. So thanks very much, everybody, for your attendance today as well. Sorry,
apologies, Chair. So Councillor Holford has his hand raised.
All right. Sorry, Eric, on you go there. Eric, on you go.
Yeah, sorry, I was on mute. If you want any thoughts on wheelchair accessibility to our building, ask, because honestly, there are some serious shortcomings in that building, and I will be more than happy to explain what a lot of those are, because some of them you won't even realise, like the fact the lifts at the banqueting hall end are too small to put a wheelchair in, for example.
We'll do Eric, with your consultation there, if you'd like, when that meeting is arranged, if you'd like to come along, I would appreciate that. As somebody that use that. Right, thanks very much. As soon as we know, Eric, we'll keep you in the loop there, okay?
Thank you. Cheers.
Right, okay, thanks everybody for the attendance today. Good meeting, and thoroughly enjoyed it there, and a lot of good things discussed. So thanks very much, and take care and stay safe, okay?
Bye.
Thank you.
Thanks very much.
Thanks very much, Chair. Bye.
Thank you. Bye. Bye. Bye.